Hi, everyone. This is Anna from the Tennessee Justice Center. We'll get started shortly, but I want to do a quick sound check. So if you can hear me, can you type into the question box that you can hear me? And Kanika, would you speak as well?
Hi, this is Kanika Young.
And let me know if you can hear Kanika. Thanks. Hi, everyone. We're going to go ahead and get started. This is Anna Walton from the Tennessee Justice Center. And just a quick review, the Insure Our Kids campaign is a statewide campaign to enroll every eligible but uninsured child in Tennessee into health insurance. And today we're going to focus mainly on the public coverage categories of TennCare and Cover Kids. And we're going to review the coverage options available, eligibility, and the enrollment process. The webinar will be about an hour, but there will be time for questions at the end. At any time, you can type your questions into the question box. And we will be sending out a recording of the presentation and the slides after, so don't worry too much about taking a lot of notes. With that, I will turn it over to Kanika, who is the Director of Children's Health at the Tennessee Justice Center.
Thank you, Anna. Happy that you guys have joined us today for this webinar. We hope that you can learn a lot and feel confident in working with families in the community who may be in need of the information. And we're happy to share it and hope that you'll pass it along. So with that, if we could go to the next slide, I will begin by talking about the benefits of enrolling kids. Beyond the obvious of being able to have coverage for unexpected things as well as continuing illnesses or chronic conditions that a child may have, there is research that shows there are long-term effects of comprehensive health coverage for kids. First off, kids who have health coverage do better in school. They miss fewer days of school due to illness or injury. They are more likely to finish high school and even go on to college and graduate. They have fewer emergency room visits and hospitalizations as adults, and therefore they earn more as adults because they are set on this pathway or trajectory for success, and they are able to become productive citizens and live a healthy life. So it's really important that we give kids the best chance of succeeding very early on, and we can do that by insuring children. Next slide. One thing that some people may not know is that almost every child is eligible for something. Our focus, as Anna mentioned, is going to be on the public coverage options, but we are aware that there are some kids who, may not qualify for these options, but our goal is to reach the children who do qualify for these options but may not know about the programs. Next slide. So the public coverage categories are TennCare, which is Tennessee's Medicaid program, and I'll talk more about what Medicaid is. The next option is Cover Kids, and that's Tennessee's CHIP program, and then TennCare Standard. Unfortunately, we don't make it easy for people by just calling the program what it is. Every state has its own name for these programs, which complicates matters, but we do want to make sure that whatever name people are familiar with, that they know that these programs exist and that there is a pathway to coverage available to them. Next slide. TennCare is Tennessee's Medicaid program. Medicaid is a federal-state partnership that provides health insurance to people who are eligible based on category as well as income. So we'll be talking more about the categories in a couple of minutes, but the main category that is the easiest to cover under the Medicaid program are children, ages that we are focusing on. And even within those categories, there are different income levels. So the main thing that people need to know about the Medicaid administers the program within certain federal guidelines because they do vary. In Tennessee, there are about 1.5 care. It covers over half of all of Tennessee's children. It covers half of the babies born in Tennessee, and it's a significant source of funding for intensive care units. It is the single most important payer for services for children with severe healthcare needs. Unfortunately, there are also income requirements. So right now, we do know that there are certain children who are above the income limits who have severe healthcare needs that are not being met currently within the state's Medicaid program. There is an advocacy option or opportunity that's available, and if you're interested in learning more about that, we would love to connect you with those resources. We are partnering with the Tennessee Disability Coalition to pursue something that's called a Katie Beckett waiver. Tennessee has the unfortunate distinction of being the only state in the country that has not taken advantage of something like the Katie Beckett waiver to extend Medicaid eligibility to children with severe healthcare needs that are above income. But that is something that we are exploring. So if you know families who are in that situation, once we go through those income limits, you'll be better able to identify that issue and get connected. But currently, the Medicaid program is serving over half of the children in the state. Next slide. TennCare's benefits are quite remarkable, and considering the early periodic screening, that's a great acronym, and it's hard to remember. Whatever a child needs on TennCare, they are entitled to receive if it's medically necessary. So that means periodic and interperiodic assessments of growth and development, immunizations, lead poisoning testing, comprehensive vision, dental, and hearing services, and all other medically necessary diagnostic and treatment services. PSDT works. Even if TennCare's benefit package says this is what we'll pay for. Next slide. So the CHIP program in Tennessee is known as Cover Kids. CHIP stands for Children's Health Insurance Program, and it also is a federal-state partnership between the federal government and various state governments. Every state has a CHIP program now. Tennessee was one of the last states to adopt the program, but it is also important as it stands on the shoulders of Medicaid to provide health insurance to families who are a little bit higher income than the Medicaid population, but still unable to afford private health insurance for their child. Cover Kids provides health insurance for eligible children 18 and younger and for eligible pregnant women, regardless of immigration status for the pregnant woman. So the idea being the woman is residing in Tennessee, her unborn child will be a Tennessee citizen, so we want the woman to have access to prenatal care regardless of whether she is lawfully residing. So if you are working with pregnant women who are, maybe not lawfully residing, or they have some concern about immigration status, they should be reassured that they can enroll in Cover Kids, and the program is not allowed to share any sort of information with an immigration enforcement office about their enrollment in the program. So this is a way for women to get health insurance and get prenatal care for their unborn children. As of fiscal year 2017, there are over 103,000 children that were enrolled in Cover Kids. That number is slightly down from the previous year. Not really sure what's going on there. We would like to think that, families are getting on their feet and they are taking advantage of the program only when they need it, and once they start making more money, maybe they can then enroll in other programs. But it also could be due to a lack of information, a lack of awareness, and also just losing their coverage and not really knowing what's happened. So that's why this campaign is really important for people to know about, so that they can get connected and get back enrolled if they are still eligible for the program. In 2018, the federal government started paying 99.07% of the cost for the Cover Kids program. This was a result of the reauthorization of CHIP that happened in the last legislative session. Some people may have heard about CHIP in the news because the funding for the previous year expired in the end of September of 2017, and there was some hand-wringing among advocates and politicians alike, because CHIP has always enjoyed bipartisan support. So it was surprising that Congress allowed the funding to lapse for a few months, but they were successful in reauthorizing it for 10 years. And so we are really excited that you have 10 years of reliable funding for the programs that state can use to then further innovation and really do some great things and not have to worry about funding being taken away on a year-by-year basis or anything like that. So 10-year reauthorization is a great reason to celebrate. CHIP will be around for at least that long, and many kids can benefit. Next slide. The Cover Kids benefits are also low-cost comprehensive health coverage, but they do not have the same EPSDT standard, so they are confined within the benefits that the managed care plan is setting for Cover Kids, Right now, the managed care plan is Blue Cross Blue Shield of Tennessee. Managed care is essentially a model that Tennessee was one of the first states to adopt, in which the state provides the funding to a managed care company, and that company, also known as an MCO or a managed care organization, is responsible for administering the program and connecting the enrollees with providers that the managed care organization has set up within their network. So TennCare or the state pays the money, and the managed care organization kind of manages it and helps their population access the services that they need under that program. Cover Kids covers preventative health services, doctor visits, hospital visits, vaccinations, well child visits, developmental screenings, and mental health. So it is pretty comprehensive. It's just not, whatever the child needs, the child gets. That's the main difference between Cover Kids and TennCare. So we always say if you can qualify for TennCare, that is the better benefit package for children because of that EPSDT standard. The Cover Kids benefit package is actually modeled after the plan that state employees are offered. So if you know someone who works for state government and they have dependents who are enrolled in their plan, it's the same benefit package that someone would get if they enroll in Cover Kids. Children can also get vision and dental care, but there's just a slightly different copay or cost sharing arrangement there. Next slide. Speaking of cost sharing, for Cover Kids, there are no premiums, but families may be responsible for cost sharing that is not allowed to exceed 5% of the family's income. So it does vary based on income and also based on the service that the child or pregnant woman is receiving. There's no cost sharing, however, for well baby and well child care, including immunizations. So that is a great benefit for people who need to take their kids in to get those shots for back to school. Next slide. So the third category that we mentioned at the start is TennCare Standard. This is unique. It's sort of a hybrid between TennCare and Cover Kids. And so TennCare Standard is paid for with CHIP funding, but the benefits and eligibility is based on TennCare enrollment. So TennCare Standard is specifically for children who are under 19 that were on TennCare at some point but became ineligible, often due to a change in income. So when that happens, they are able to roll into TennCare Standard until they turn 19. There are a few requirements for them to roll over, however. So one of them is that they don't have access to group health insurance. And by group health insurance, we mean employer-sponsored plans. So it doesn't count if the child's parent has a marketplace plan from the ACA or some other individual type insurance. It must be a group policy, such as the employer-sponsored plans that most people have access to. And it doesn't matter if the group health insurance plan is affordable or not. It's just whether it is offered to the employee. So if they have access to that, then the child cannot roll into TennCare Standard. But if they don't, you also look at the citizenship status of the child. So they have to be a U.S. citizen or U.S. national or other eligible non-citizens. And there is an income requirement for TennCare Standard. So for children who are below 211% of FPL, which stands for federal poverty level, that equates to about $52,000 for a family of 4. Or if they are above that income threshold, but they also have a qualifying medical condition that would have prevented them from getting health insurance prior to the Affordable Care Act, then that's another pathway for them to be eligible for TennCare Standard. And so the qualifying medical condition piece is really an acknowledgement of that before the Affordable Care Act was passed, there were no restrictions on insurance companies being able to exclude people who had certain conditions that would be costly for the insurance company to cover. And so the Affordable Care Act, by doing away with those kind of underwriting options for insurance companies for pre-existing conditions or age or other factors that they were able to tie into their decisions as to whether to offer coverage and also whether what amount they would charge people for insurance. The ACA did away with that, and so this is basically saying those types of conditions would allow the child to roll into TennCare Standard even if they're above 211%. There is a laundry list of conditions that would qualify. Just to give you an idea, we're talking about very serious illnesses like cerebral palsy, congestive heart failure, lead poisoning, and even juvenile diabetes. So if you know of a child who has some serious health condition and you're not sure whether it's qualifying or not, there is a list that we can provide, and we encourage people, regardless of whether the condition is on the list or not, go ahead and reach out. So there is no separate application for TennCare Standard. Basically, you would be able to roll in if you lose TennCare and you receive a letter saying you're no longer eligible for TennCare. If they don't at that point say you have the option to roll into TennCare Standard, you would have to appeal, and there'd be information in that letter as to how to appeal TennCare's decision. And in that appeal, you would say, I am eligible for TennCare Standard. And there's also a number that the family could call that we'll share a little bit later in the presentation. Next slide. So just to give you an overview of the numbers here, there are about 1.5 million children in Tennessee as of the latest data, and the majority of them, over 770,000, are enrolled in TennCare. The next highest category would be those employer-sponsored, so those are people or children who live in households where their parents have added them to their insurance plans. And then you have over 100,000 on TennCare Standard and Cover Kids. Again, that's the CHIP funding. And then you have 21,000 enrolled in marketplace plans. That's the Affordable Care Act, healthcare.gov. And 53,000 are uninsured. So that's the population that we are targeting with this campaign, that 53,000 uninsured. Of that number, there are about 34,000 or over 34,000 that are actually eligible for the program. You may be wondering, okay, what about, the difference between the 53 and the 34? This would sort of account for children who are above income and they don't have any sort of qualifying condition or significant medical bills that would kind of bring them within the income limits, or children who are lawfully residing immigrants, but they haven't been here for more than 5 years. So there is a 5-year bar or waiting period, even for lawfully residing immigrants, to where they cannot access programs like Medicaid until they have been in the country for 5 years or more. Next slide. This map of Tennessee is color-coded to indicate the different numbers of uninsured children across the state. So you can see that the counties that have the deeper orange color have the highest number of uninsured children, and Shelby County is leading this list at over 11,000 uninsured children, followed by Davidson County at over 6,000, and then Knox County at over 3,000. So really concentrating our efforts in these counties and trying to partner with organizations and people who work with the community and see families who may be qualified and eligible for these programs and don't know about them. So this is just and something to keep in mind if you work or live in one of the darker colored counties. That's where the greatest need is based on the information that we have. Next slide. So I mentioned before that to qualify for the public coverage categories, that's TennCare and Cover Kids and TennCare Standard, you have to be not only within a certain category, such as children, but you also have to be below a certain income level. So for, if you look at the far right column at 250%, that's the upper limit for Cover Kids. There's a 5% bump which means people can be up to 255% of the federal poverty level, but this is the latest information that's available from TennCare, so they haven't factored in that 5% bump. Instead of trying to, memorize these percentages or these dollar amounts, what we want people to know is that anyone can apply for these programs, so you should go ahead and apply and see if you're eligible. And if there's some question about the income, there are certain things that can be deducted. So if you are kind of close to the line and you're not sure if your income disqualifies you, you should still apply, because there may be a way to bring your income within the limits. So a couple of things that can be deducted are legally obligated alimony, student loan interest that is paid in the month of the application, and other expenses such as educator expenses. So if you are a teacher, you can deduct up to $250 that is spent on things for your classroom necessary expenses or things that you use in your profession. So that's just to give you a sense of the types of things that may be deducted from your income. But again, for anyone who is close or they think they might qualify, please just go ahead and apply. And the worst that could happen is that you're denied, but at least you have the option and the opportunity to get coverage. Next slide. Coverage for people on Medicaid. So the gray columns towards the left represent children at different age brackets. So the income limit varies depending on the age of the child. So in that first column, you see for children who are 0 to 1 year old, they can earn up to, or their household can be up to 195% of the federal poverty level. Again, this is for the household. So you have to consider the number of people in the family as well as the income to figure out what that limit is. So this slide, as well as the previous one, are kind of used in connection to figure out, am I in the right category, and what is the corresponding percentage of FPL that applies to that category. Above 195% of FPL for children 0 to 1, you have Cover Kids in sort of the light purple color, and that is from 195 to 250% is where Cover Kids would kick in. Again, if you are eligible for TennCare, then that's the better program to go for. Cover Kids is also good, but it just doesn't have the EPSDT standard. The fourth gray column represents medically needy. So this is a special category for people who may be above 250% of the federal poverty level, and we'll talk through a hypothetical about that in a second. But essentially, for people who fit in that category, anyone in the household who has significant medical expenses because of a health condition, they can subtract those expenses from their income in order to come within the 250% or 255, considering the 5% bump. So deducting the medical expenses from income to come within the medically needy spend down parameters would be a way to qualify for TennCare. And then TennCare Standard is that last gray column. Again, that is for up to 211% of FPL, but if you have that qualifying medical condition, you can be above 211% and remain eligible for TennCare Standard if you lose TennCare. And then another column or category that I want to draw your attention to is pregnant women, the first blue column, and also the orange column. This is for former foster care children up to age 26. They are still eligible for TennCare if they were enrolled in TennCare or eligible when they aged out of the foster care system. This is a companion provision to the Affordable Care Act provision that was really popular, where parents could keep their children on their insurance until the age of 26. So this is providing that same sort of opportunity for foster children. And not many people know about this category. It's not really advertised. And so we want to get the word out to foster care kids, even if they have let their coverage lapse in between aging out and now. If they are under age 26 or at age 26, they can enroll or re-enroll in TennCare and keep that coverage. So next slide. So here's a hypothetical just to kind of demonstrate a couple of the categories and eligibility information that we just talked about. This is Eli and Amy. Eli is 28 and Amy is 5. That's a household of 2. Their income recently increased from $1,300 a month to $2,750 a month. So for a family of 2, they are slightly above the income limit for TennCare, and they don't have any resources to factor in terms of their eligibility. So the question is, what is Amy eligible for? Next slide. And again, Amy is eligible for TennCare Standard. Remember, it is for children who are under 19 who had TennCare, but they lost their eligibility for some reason. Usually it's income. They are able to roll into TennCare Standard. Eli, doesn't have access to employer insurance. Maybe he works a job that doesn't offer it, and they are below the 211% of federal poverty level. So it's very common right now for children to lose coverage through the redetermination process. This is something that we are aware of at the Tennessee Justice Center, and we're working with families to help them appeal or to remind them or guide them through the process of filling out the packets that they are receiving. So redetermination is an annual process where TennCare must determine if the enrollees are still eligible to be on TennCare. This is something that had been paused for a while because TennCare had been working on getting a computer system online to be able to process these types of applications, but they have forged ahead with a manual redetermination process because there have been a series of delays with getting their computer system online. They are still projecting that the computer system will be live in 2019. Remains to be seen if that actually happens. I would not hold my breath. But in the meantime, they have forged ahead with a manual process where they're sending packets to families that are over 90 pages in length. And a lot of families get them. They don't know what they are. They disregard them. They may go to the wrong address because TennCare may not have updated the addresses in their computer system for the families, and so the families don't receive the packets. There are a whole host of issues with this manual redetermination process. And so some families may go to the doctor or go to a pharmacy and try to get medicines, and they're told, oh, you don't have TennCare, and they had no idea. So this is a real issue to the point where the state comptroller's office had done a review and made some recommendations to TennCare about this fiasco, and TennCare looked at it and decided to stop sending out the packets. But for families who are already sort of in the queue, they may still be receiving them, and for families that have already received them, they can't ignore them. They still need to fill out the packet and return it in order to keep their coverage. So we're trying to get the word out, make sure people open all their mail and that they're paying attention to this request for information from TennCare so that they don't fall into this category. But for those who are no longer eligible, they fill out the packet, they return it, and determine that they have lost eligibility for whatever reason. TennCare Standard is still an option for children under 19. Next slide. So I mentioned the medically needy spend-down categories. This is just to illustrate that point. So you take the income, you subtract the medical bills, and then you see whether the family is below the spend-down limit. So the medical expenses that kind of qualify for this category is really broad and varies. It includes things like health insurance, premiums, over-the-counter drugs up to $10 a month per household member, any prescriptions that are ordered by a doctor, dental costs, any out-of-pocket costs at the doctor's office, hospital bills, any vision, hearing, or walking aids, even guide dogs can qualify to be have that expense deducted for this category. So it's really a laundry list of things that TennCare looks at, and it's for any member in the family. So we're trying to say, okay, what does the child qualify for? It doesn't matter if the medical bill is not the child's bill. It could be someone else in the family. So the next slide will sort of demonstrate that. And again, if you could advance to show the information again. Okay, so we're looking at Elroy. Elroy is 10 years old. They have, he's in a family of 4. So Rosie the robot does not count. So you look at the income for that family of 4, and they are earning $4,500 a month. Elroy has medical bills of $150. Judy has $2,000 in bills. Jane has $1,700, and George pays in prescription. And they have $3,800 in the bank. So all of those things added up, you would see whether they are below the spend down limit for that category, and you would see that Elroy does qualify for medically needing spend down. If you can go to the next slide and then beyond. Next example is, or hypothetical, is a newborn named Catherine. Catherine is 2 months old. She has been in the NICU since she was born. Her parents have over $9,000 in income, and they have $1,500 in the bank. So the question here is, what could Catherine qualify? As we know, the NICU can be very expensive. Not all, even if her parents have health insurance, they may not be able to afford the care for Catherine, especially if she has significant health care needs that are requiring her to be hospitalized for this long. So on the next slide, we see again that Catherine can qualify for something called institutional TennCare. So institutional TennCare is available to anyone who has been in a nursing facility, things of that nature. It does not cover mental health treatment, unfortunately. So if you have a newborn and this child has had to be hospitalized, or even a child, older than a newborn, if they've been hospitalized for more than 30 days, what institutional TennCare does is omits consideration of the parent's income. So the parent's income no longer counts against the child who's been institutionalized. And so you would only consider the child's income. For most children, they don't have any income, but if they are eligible for SSI, you would factor in that income from their SSI check. So only the child's income counts, and if they are below the income level, then they qualify for institutional TennCare, and they would be a family size of 1 in that instance. So on the next slide, we see a real-life example of a few of these concepts. So this is Sheila and Jace Hobbs. Sheila adopted Jace from the hospital, she and her husband. Jace was born prematurely. His biological mother struggled with drug addiction, and Jace spent the first 10 weeks of his life in the NICU with various medical conditions. Sheila Hobbs and her husband Dave adopted Jace in 2016, and he had significant health care needs continuing. In April of 2017, he was admitted to Vanderbilt Children's Hospital for surgery to treat a seizure disorder. As he was recovering from the seizure disorder surgery, he developed a breathing condition that made it difficult for him to breathe and required placement of a breathing tube. After 2 months, he was able to go home, but his doctor said he needed home nursing care in order to stay safe and healthy because of his breathing condition. Unfortunately, Sheila and her husband were enrolled in an ACA plan that did not cover home nursing care. So they had a child who was ready to go home with them. They wanted to bring him home, but they couldn't because they needed to have nursing care in place. So they were trying to figure out their options. Sheila came across the Tennessee Justice Center and she called, and we were able to figure out a way to get Jace enrolled in institutional teen care. So at that time, it would have cost them $20,000 a month to pay for this care on their own, which was not feasible. So once they got institutional teen care, Jace was able to come home and be discharged from the hospital and be able to get that nursing care. But remember, there is a redetermination process. And so once teen care looks at their income, Jace would be determined that he's no longer eligible for teen care. But in that instance, the teen care standard would kick in. So because Jace could get teen care in the hospital, he can still roll into teen care standard. And because of his qualifying medical condition, they would not be ruled out because of their income, because they may be above 211% of the federal poverty level, but he has a qualifying medical condition. So that is how these concepts kind of work together in real life. Jace was approved for institutional teen care. He went home, and he's able to roll into teen care standard and remain on that program until he turns 19. Next slide. So the uninsured children in the state kind of crossed all different income levels and age groups. This is just to give you an idea of how those numbers kind of play out. So there are 4% of the uninsured children are below 100% of the federal poverty level. There are a number that are above 300% of the federal poverty level. Some of those may not qualify because of that income, but again, if they have a qualifying medical condition, if certain things can be subtracted from their income to bring them within those limits, then they could still be eligible. So basically, we want to get the information out to everyone. We want to dispel the myth that these programs are only for, really low income people. As you can see from the prior slide, a family, for example, that has 4 members can earn up to $62,000, which is a considerable amount of money still, but not enough, unfortunately, to be able to afford health insurance. But at that income level, they can qualify, or the children in the family can qualify for Cover Kids. So the takeaway is, don't assume because someone makes money or feels like they earn enough that they don't qualify. And then in terms of ages, we have seen that mostly older kids are eligible but not insured, ages 6 to 17. So we also are targeting high school students to educate them about healthcare and turn them into healthcare advocates for themselves and their peers. And so if you're interested, there is a TJC Student Ambassador Program that connects high schoolers to information and training opportunities to become advocates and to participate in some pretty cool projects to help spread the word about teen care and Cover Kids. For example, the class of students that participated in the program in the previous year did things like tabling at their high schools during lunch and screening classmates for eligibility and sharing information with them about the programs. Another young lady in the Student Ambassador Program held voter registration drives where she reached over 50 teens who were eligible to register to vote. So those are kind of just a couple ideas of things that we want to engage high schoolers to be proactive and to really recognize healthcare as a social justice issue. For more information about the Student Ambassador Program or anything else that we talk about, you can go to our website at www.tnjustice.org. Next slide. So for standard insurance, like your employer-sponsored plans or plans on the marketplace, they have what's called an open enrollment period where you can only enroll in insurance during that set time unless you have some qualifying life event like a marriage or divorce or death. But for Medicaid and CHIP, which are the TennCare and Cover Kids programs in Tennessee, enrollment is always open. So families can enroll at any time during the year if they qualify for these programs. Unfortunately, in Tennessee, the only way to apply is through healthcare.gov. Again, TennCare does not have its own computer system, so they aren't able to offer any other application portal right now for families. This presents a problem for people who maybe can't access the internet or don't have computer literacy or aren't able to figure out or understand the application. There's not in-person assistance that is offered by the state. That's where Insure Our Kids kind of comes in. Next slide. So everyone must apply through healthcare.gov except for a couple of categories, presumptive eligibility, choices, and Medicare savings programs. Choices and Medicare savings are not specific to children, so we won't go into detail about that, but we'll talk a little bit about presumptive eligibility in the next slide. So we can go ahead and advance. This is a list of the items that people would need to have together when they go to apply on healthcare.gov. So if they're doing it on their own or if a professional is assisting them, it's a good idea to have this information on hand to kind of speed up the process. One thing I wanted to point out here is for people who work jobs that don't provide a traditional paycheck, like with a pay stub or a W-2, that does not preclude them from applying for the program. They can submit a sworn statement in lieu of some other type of documentation to verify that they are unemployed or that they don't have verifiable earnings, for example, if they're paid in cash. And so they would provide a sworn statement as to what their income is, and that is acceptable for the application. Next slide. This is just a continuation of the application checklist. Again, when you're applying, you would have to have the information for everyone in the household. So it's a good idea to sort of do that homework and gather that information beforehand to kind of expedite the process. Next slide. So I mentioned that everyone has to go through healthcare.gov to apply for TennCare and Cover Kids, but there are exceptions for the presumptive eligibility category, and newborns is one of those categories. And so for newborns, there are three kind of concepts to be aware of. One is TennCare deeming, the second is Cover Kids deeming, and then newborn presumptive eligibility. Next slide. So TennCare deeming is for moms who are on TennCare. Their child is deemed eligible for TennCare for up to a year. The coverage starts on the date of birth, and they would enroll by calling the Tennessee Health Connection at the number listed. So this is basically a way to provide coverage for the child while the application is pending for the child to get their own determination of TennCare eligibility. So we understand that moms are busy when the kid is first born, and so we want to have a way for children to be able to still go to the doctor and get those routine checkups and shots and everything that they need during that first year of life and not have to worry about having effective insurance coverage. But it's important that the family get that application in as soon as possible so that when that year is up, they can already have a decision and they won't have any sort of lapse in coverage. Next slide. Cover Kids deeming is similar. It is for moms who are on Cover Kids. Again, Cover Kids is available to children and pregnant women. So as a pregnant woman, if you enroll in Cover Kids, then your child is deemed eligible for up to a year. The coverage starts on the date that the mother enrolled in Cover Kids, which is a little different from TennCare. So when the mom enrolls, she's getting prenatal care, and then the child's, the newborn's care would be covered by Cover Kids for that first 12 months. To enroll in the Cover Kids Deeming Program, the mom would have to call Cover Kids and simply report that her child has been born, and then she would need to still do an application for the child to remain covered on Cover Kids beyond 12 months. Next slide. Newborn presumptive eligibility is for babies 12 months and younger who are born to mothers who are on private insurance or no insurance. The coverage starts on the date of application. And the way to apply is on the next slide. Parents have to call the Tennessee Health Connection and enroll the child in presumptive eligibility. Parents still must do an application on healthcare.gov, however. So this is just a way for the child to have coverage while the full application is pending and they're waiting on a final eligibility determination for the child. Next slide. We reached out to TennCare to kind of share information about why some people may not be able to maintain coverage or some hiccups that they run into during the process. And what TennCare shared is that they sometimes get documents that are not signed in all the right places. So we're trying to get out these best practices to people to remind them to make sure they're signing everything that's required, make sure that they are answering all questions or that they write not applicable on something that doesn't apply to them. And also to open all mail from TennCare. Again, those redetermination packets may not be obvious that they're from TennCare and they're really thick and daunting, and so some people may just ignore them, and that is a mistake. You should definitely open all mail and timely respond to any inquiries or requests that you get from TennCare so that you are providing information within the deadlines that they've set for determination. You should also promptly inform TennCare of all address changes. Anyone who's currently enrolled in TennCare needs to make a habit of notifying TennCare if they move and make sure that they have their current address in case they need to reach them. Next slide. So I mentioned a second ago that Tennessee sends everyone to healthcare.gov and they don't provide in-person assistance. So that's where Insure Our Kids kind of steps in and wants to help people who need assistance to enroll in these programs and to figure out if they're eligible. We have partnered with the Tennessee Healthcare Campaign, and they have provided their Get Covered line, which is 1-844-644-5443, and they have volunteers who will answer that line and screen families for eligibility for TennCare and Cover Kids, and they will either help the family or refer them to another Insure Our Kids partner, which is Family and Children's Service. Both of these are nonprofits. Family and Children's Service may sound similar to the Department of Children's Service, but they are not the same. Family and Children's Service is a nonprofit, and they help people navigate the Affordable Care Act plans as well as TennCare and Cover Kids. If you know someone who has already applied and been denied, then the Tennessee Justice Center is available to help them file an appeal and get back on the programs if they qualify. And our toll-free number is also listed here. Next slide. So these are just a few of the barriers that we are aware of, and we want to get help in identifying others that people may know about. So income is listed, and I mentioned earlier that Tennessee has not taken advantage of the Katie Beckett waiver in order to expand Medicaid coverage to children who have significant healthcare needs but are in higher income households. That is an opportunity that we are aware of to kind of advocate and address that issue. Immigration status, I mentioned the 5-year bar for immigrants. Federal law imposes that restriction, but states do have the option to seek an exception. Tennessee just has chosen not to make that exception. So the 5-year bar is a barrier. There's also concerning immigration fear among citizen children who are in mixed immigrant status households. There is a new rule change that is about to drop any minute, known as the public charge rule, and that would impact the immigrants' ability to gain citizenship if they have taken advantage of any programs. Essentially, the government is assessing when they're determining citizenship who is likely to be dependent on the government. And so certain programs historically have been listed as eligible for that determination, and this new rule is going to expand that to cover things like Medicaid and CHIP, unfortunately. So there is fear in those families. If they take advantage of these programs, then they will later not be able to gain citizenship status. The Tennessee Justice Center is working in partnership with Turk to educate people about this rule change. And sign up for email alerts if you're concerned about this issue and what you can do to stop the chilling effect that it will create for families who don't take advantage of the programs they're eligible for. A couple of things about parent switching employers. This is just to say that these programs can be used temporarily, and so when someone is waiting on employer-sponsored plans to become effective, this is a good way to make sure that their child can still be covered and see the doctor when they need to, and then they can put them on their new plan if they can afford to. If not, again, there are options available under Cover Kids for people who are above that income limit for TennCare. The family glitch, I'll just mention quickly, this is the term for the sort of hiccup in the Affordable Care Act in deciding what is affordable, what is considered affordable health insurance for people when you're trying to decide if they're eligible for a subsidy or a premium tax credit to purchase plans on the marketplace. The family glitch is essentially where, when determining affordability, you don't consider the cost of adding a dependent to the employer's coverage. You just look at the cost to the employer. And so unfortunately, for some people, while it may be affordable for them to enroll in their employer-sponsored plan, it's not affordable to add their dependents. And so these programs are an option until we can figure out a way to clarify what was intended in the Affordable Care Act for the cost-sharing assistance. And then death of a parent, I just wanted to mention that in adoption assistance agreements, there is an option under something called Title 4E, where children with special needs who otherwise may not be adopted can get Medicaid. So this would be sort of an incentive to adopting parents to not shy away from those special needs kids because they may not think they can afford to care for them. Medicaid is an option, and sometimes adoption attorneys, when they're drafting those agreements, they may not be aware of that, and so we want to kind of spread the word to include Medicaid when it's allowed. Next slide. This is a list of our partners, and we're very excited to have all these organizations working with us to spread the word about TennCare and Cover Kids and get more families enrolled if they have eligible children and pregnant women. We are excited to release an educational video very soon, so we hope that you will stay tuned and check out the video and share it with everyone you know so that they can get help and get enrolled in the program. And so we still have 4 minutes left. If there are any questions, I'm happy to answer them. And thanks for your attention. Anna, do we have any questions?
No, there are no questions yet.
Okay, well, we'll hang on for just a minute to give you time to type in a question if you have one. And while you do that, I will highlight the Insure Our Kids website. You can go on there and check out what's going on with the campaign, and also download any flyers or infographics that you want to share. And the video that I mentioned a second ago will be posted there when it's released, so you can check back to the website for that video and share it. So if there are no questions, thank you for joining, and make sure if you know of other professionals who work with families who could benefit from the information. This webinar happens at the same time, second Thursday of every month, 11 o'clock, and they can tune in for the next one. Thank you.
Thank you.